I'm her mother, and I consent to her being in this video and have it posted on YouTube. I would knock on the door, perform hand hygiene, introduce myself. Hi, Dior. I'm Brittany. I'm a student nurse practitioner, and I'm going to be doing your musculoskeletal exam today. Is that okay?
Yes.
Okay, can you go ahead and put your hands out? I would start by inspecting her hands and her wrists. I'm looking for any redness, swelling. I'm looking for symmetry. I'm looking for any nodules or abnormal findings. I'm going to palpate her hand. I'm going to palpate the distal and proximal interpharyngeals, and then I'm going to palpate the MCP. I'm also going to go up to the wrist, and I'm going to palpate her metacarpal and her carpal bones. So I'm feeling for any pain or tenderness, which she doesn't have. I'm going to go ahead and have you make a fist so we can do range of motion in your hands. So make a fist, and then go ahead and open your hands, and then I'm going to have you put your fingers together, adduct, and then we're going to abduct, open them up, and then adduct back. And I'm going to have you just move your wrists. I'm going to have you flex them up and then extend them down. And so she was able to do that, and so she has full range of motion in her hands and her wrists. I'm gonna go, and then we're gonna do a specialty test for carpal tunnel, which is Tinel's. So I'm gonna have you pronate your hands like this, and then extend your wrists down, and I'm gonna tap on her medial nerve. Do you feel any pain?
No.
Any pain?
No.
So a positive finding would be pain or tenderness when I tapped her medial nerve, which she did not have any. Another specialty test for carpal tunnel is Phelan's. So I'm going to have you put your hands in prayer position, and then I'm going to have you put them down. And so she was able to do that with no issues or pain, which is negative for carpal tunnel. Next, we are going to move down to the elbows. I'm going to inspect her elbows. I'm going to be looking for redness, swelling, symmetry, any abnormalities of her joints. I'm going to palpate her olecranon, which is the bony part of the elbow, and then I'm going to palpate the medial and lateral epicondyle. And so there was no pain, which is a normal finding, or it'd be abnormal if she did have pain. I'm going to test her range of motion in her elbow. So I'm going to have you extend your elbows out and then extend them back in. And then I'm going to have you extend out and flex. And what else do we do for elbows? Oh, and then I'm going to flex your arms out, and then pronate your hands. So turn your hands up like that. So she was able to do that with no issues. So that is the normal finding, and she has full range of motion in her elbows. Next, I'm going to start by inspecting her shoulders. So I'm looking for the same things: redness, swelling, any abnormalities of the joints, which I do not see any. I'm going to palpate her AC joint, and we're palpating to see if she has any pain or tenderness, which she doesn't. We're going to go down to her bicep grooves in here. Any pain? No. So that's a normal finding. And then we are going to go laterally and feel the tubercle of the humerus, which there's no pain there, so that is a normal finding. I'm going to have you flex your arms, put them 180 degrees straight up, and we're testing for range of motion in her shoulders, and then bring them down. And then I'm going to have you extend your arms backwards 60 degrees, which she was able to do with no difficulty. And then I'm going to have you abduct your arms out and then adduct them back in. And then I'm going to have you take one arm and put it across, and then take this one and put it across here. And so she has no pain or difficulty. That's a normal finding. And then I'm going to have you take one arm and scratch your shoulder on the opposite side up there. And this is a scratch test. And then I'm going to have you take the other arm and scratch this shoulder and that is, she's able to do that with no issues. So that is a normal finding. And then a specialty test for the shoulders is a speed test. So I'm going to have you put your hands out in a fist, and then I'm going to push down and you push against it. And so she was able to do that with no issues. So that is negative for that test. Next, we are going to go to the head and neck. I'm going to be inspecting for any deformities and for her posture. Can you sit up straight? So she's able to sit up straight. And then I'm going to palpate her. I'm going to take 2 fingers and palpate the tragus. And then I'm going to go down. Can you open your mouth and shut it? So I am palpating for her TMJ, her tendons. And I didn't feel any popping or abnormalities. And then I'm going to go down and I'm going to palpate her sternoclavicular, and then her trapezius, and then rhombus in the middle of the back here. And I don't feel any abnormalities. And did you feel any pain?
No.
So that is the normal finding. Next, I'm going to have you flex and extend your neck. So I'm going to have you put your head up and then down. And then I'm going to have you turn your head side to side. And so we're testing for range of motion in her neck. And then I am going to have you touch your ear to your shoulder and do it on that side. And then can you open your mouth and then do it on both sides? Okay. And then I am going to have you just roll your head in a circle. And so that kind of checks for the full range of motion, which she's able to do with no issues. So the last test for the neck is the Sperling's test. So I'm going to push down on your head, and then you turn your head side to side. Any pain?
No.
Pain there would indicate cervical compression or something that needs to be looked further into. So next from the neck, we are going to be assessing her spine. So I'm going to look from the side. I'm just looking for any kyphosis or lordosis. I don't see any. She has good posture and her spine looks straight from the side. And then I'm looking at her shoulders to make sure they're symmetrical. And one's not higher than the other. And then I am looking, I'm going to have you stand up so I can look at your spine. I'm also going to look at her, not yet. I'm going to have you look at your, her iliac area and then the crease of her buttocks to make sure that they are symmetrical and one's not higher than the other, which would indicate an issue. And then next I am going to have you bend. Oh, actually I am going to percuss your spine, and I'm going to start I'm going to palpate, and then I'm going to fill in the intervertebral spaces all the way down, and then I'm going to palpate starting at C7, and I'm listening for tympani, and I'm going to do that all the way down, and I'm feeling for any indentions or protrusions, which I didn't feel any. So next I will have you bend over, and I'm going to stabilize your hips, trying to touch your toes. So I'm looking for any scoliosis or curvatures of the spine. Okay, and can you come back up? And then can you bend back? No, just your back. Tilt your back back. So I'm having her bend back at 35 degrees, which she was able to do with no difficulty. And then I'm going to have you bend side to side at the spine. So she had no difficulty doing that, no pain. And then I'm going to have you twist side to side. And so she was able to do that with no pain or no difficulty. And then I'm going to have her do leg raises. So lift one leg out, put it back down, and the other one. Any pain or difficulty? And she was able to do that. And you can also do the leg raises laying down to check for any spinal issues. And then I'm gonna check for her hips. So I'm gonna have you lay down on here, and I'm just gonna first inspect her hips. I'm just looking for symmetry, any abnormalities in the joints, any nodules, anything like that. I don't see anything. I'm looking at her ASIS, and then I'm going to have you turn to your side, and I'm looking at her greater trochanter area. I'm looking at her iliac joints, the little dimples in her back, to make sure that they are symmetrical. And I'm also going to have you abduct your leg, so go up and then adduct back to your body. So I'm testing for range of motion, and I would do that on both sides. So go ahead and turn over and do your leg on that side. And so I'm looking at both sides, and then put your leg back down. Okay, and then lay flat on your back. And so I'm just gonna tilt your leg up a little bit, and then at 45 degrees, and then I'm gonna have you lift your leg up and then back down. Any difficulty doing that, I'm gonna do it on both sides. So 45 degrees, lift your leg up, flex it, extend, and then flex back. Okay, good. And then I'm gonna have you put both of your knees up, and then I'm gonna abduct, and then adduct back. Any pain with that? Okay, and then I am going to do the Thomas test, which I'm going to put your knee up to your belly. Any pain with that?
No.
Okay, and then I'm going to do this one. Any pain or difficulty with that?
No.
Okay, and then next I am going to do another specialty test that tests for range of motion with the hip. That is Patrick's test. So I'm going to take your heel and I'm going to press it to the back of your leg. Any pain or difficulty with that?
No.
And then we're going to do the same thing on this side. Any pain or difficulty with that? Okay, and so next we are going to check her knees. I'm going to have you sit up on the edge of the bed here. I'm in the exam table. And I'm going to have you put your knees over and just, sit back up there. So I'm going to start by inspecting the knees. So I'm just looking at for any deformities, redness, swelling, and then I'm going to palpate the knee. So I'm just palpating all over. I'm going to palpate the suprapatellar pouch, which is down here in this area under the patellar. And then I'm going to palpate the lateral sides. And I'm also going to palpate her fossa in the back to feel for any Baker's cyst, which I do not feel anything. So that is a normal finding. And then I'm going to go ahead and have you extend your legs out and then flex them back. So that is a normal finding. She's able to flex her knees. And then I'm going to just have you flex the bottom of your legs out like this, and then adduct back in, which she was able to do. So that tests for range of motion with the knee. I'm going to have you lay back down, and I'm going to do check some of the specialty tests that they have for the knee. Is the valgus stress test. So with this one, I'm going to take my hand and I'm going to put it on the outer part of her leg, and then I'm going to take my other hand and put it on the inner part of her ankle, and then I'm just going to press, and I'm just looking for any give, which I don't see. I don't feel. And do you feel any pain with that?
No.
Okay, and then the next is a varus stress, which is almost the same thing, except you are testing the other way. So your hand is going to go on the inner knee, and then the lateral side of the ankle. And so I'm pressing. I'm checking for pain or any give. Did you feel anything?
No.
Okay, so that would be a normal finding. That is to okay, sorry. And the next specialty test that we're going to do is the Lachman's test, which tests the ACL. So basically, we are going to take your knee. What are we going to do for Lachman's test? Oh, we're going to put your knee up, and then I'm just pressing down to see if I feel any give, which I don't. And then I'm going to do the same thing with this side. Any pain or any difficulty with that?
No.
Okay, and then the next test is the drawer test. So I'm going to have you put your leg up, and I'm going to actually sit on your foot, and it's kind of like the Lachman's test. And I'm going to be doing the same thing, just kind of feeling, and that's kind of testing her ACL if she had any difficulty. And then I would do the same thing with this foot, sit on it, and then just press. Any pain?
No.
So that's a normal finding that she doesn't have any pain. And the next specialty test for the knee is McMurphy's. McMurray's. We're not on abdomen. And for that test, I'm going to have you flex your knee up. And then, so just flex your knee out and then rotate. And any pain or difficulty doing that?
No.
Okay, so that is a normal finding for the knee. And then next we're going to go down to your foot and ankle. So do you want to sit back up on the exam table? Okay, and so for this, I'm doing the same thing. I'm inspecting for any redness, deformities, swelling, any nodules, and making sure that her knees and her feet are symmetrical. I'm going to palpate. I'm palpating her heels. I'm palpating the Achilles, and I'm palpating the bottoms of her feet and her metatarsals and her tarsals, her phalanges in her feet. Do you feel any pain?
No.
Okay, and so any abnormal findings would be like pain or tenderness in her Achilles, which she did not have any. Then we are going to do range of motion. So basically, I'm going to have you open your toes up, abduct your toes, and then adduct, put them back. Oh, so we're going to have you adduct, put your toes out, and then adduct back in. And then I'm going to have you extend your feet up like that, and then put them back down. And then can you move them around in a circle? No, just your ankle. Move your ankle around like that. Now you try. So if she had good coordination, she doesn't have any difficulty doing that. And she's able to invert and expert her feet. And the last thing that I'm going to check, that you can also check when she's standing up, is I would have her turn around and I would check her feet to see if she has, if she's flat-footed, which is best done standing up because then you can see if there's an arch in her foot or not. And that concludes her musculoskeletal test. Thank you.